Welcome to the PGTV special on the coronavirus disease, COVID-19. I'm Brian Lacey, and we want to talk about what our local government is doing for the residents of the Polk County community. Joining us in studio is Director of Polk County Emergency Management, Paul Womble. Paul, welcome to the show.
Thank you, Brian.
For the residents that might not know, talk to us a little bit about what happens at the EOC under a normal circumstances, and then, of course, how it relates to what's going on with the coronavirus COVID-19 epidemic.
Okay, so our County Emergency Operations Center, when there's an emergency, our job is to coordinate with stakeholders. Here in Polk County, that's all of the cities, our constitutional partners, private companies, faith-based, volunteer organizations. We also need to coordinate with our surrounding counties, their emergency operations centers, up to the state and federal government. The challenge is, normally our normal mode is bring everybody together. If there's a hurricane or other type of disaster, the EOC is built to sustain those, bring everybody together in one place, bring our senior leaders, the county administrator and his office, senior staff, our elected officials, to bring the team together. That's what we call the team. Well, in this situation, we can't do that. We have to keep it safe. We have to keep each other safe. So the processes that we do for coordination are ongoing. The biggest challenge is, instead of everyone being together in the same building to work together, be one team, one fight, one team, we're doing that virtually, doing that remotely, primarily through technology.
Talk to me a little bit, I believe it was John Wooden that said perfect practice makes perfect. And in the past, we've gone through multiple hurricanes. Talk to me a little bit about how those natural disasters help prepare us for this pandemic.
Yeah, so we train together. We want to exercise together. We plan together. We have plans for various things. When you have an event, whether it's a hurricane or in this case, COVID-19, there are policies, legal things. A lot of folks have roles. It's really about bringing that team together. So we train together, we exercise together, we work together, we build those relationships, and really that's the fundamental of emergency management. You want to get to know people, work with them, understand what they do, so they understand what you do. Put all that together in a non-event, and that's part of our training and exercise plan. But Polk County has strong relationships. All of the cities, the county, whether that's down to like a department level, all the police chiefs and the sheriff, and their senior staff, they talk constantly. They work together every day. The fire department's the same way. The relationship with the Department of Health and our hospitals, especially those local representatives. Hospitals have folks that have emergency management responsibilities at the local level every day. We work with them. So when it's time to, activate, in this case for a pandemic, we have those relationships. We know each other. We know how to get a hold of each other. And that just makes things go so much smoother.
Let's talk a little bit about the resources that it takes to combat the pandemic and what you guys are doing.
Sure. So as we've seen in the news, personal protective equipment, PPE, is critical to keep our first responders out in the street safe. It's critical to keep doctors and nurses and all the folks that work in hospitals, in long-term care facilities, really the health and medical network within Polk County as a whole. You want to keep them going. You want to keep the residents in long-term care facilities, nursing homes and ALFs and others. We don't want to have an outbreak in a facility. So we've been working with all of those types of agencies the best we can through government sources, up to the state and the federal government, request those resources. We're at close to 400 missions. We track each one by a mission that we've sent to the State Emergency Operations Center in Tallahassee. They're doing the best they can to source, locate, whether it's from the federal government. The state of Florida is attempting to buy PPE itself to distribute down to the local level. There's just not enough to go around. The supply chain is impacted. This is a worldwide situation. So everyone's fighting for those resources. So we're doing that work based on those resources or those resource requests from those facilities, from those agencies, And then as we get the products down from the state, we distribute those out through our warehouse that we activated on, I believe, on March the 20th. So we've been doing this. We're almost at the end of 3 weeks. We've had the EOC activated, working with our partners, working to get PPE out to the healthcare and first responders.
As we heard from Dr. Banerjee in a previous interview, necessity being the mother of invention, it's a lot like the Marine Corps: adapt, overcome, improvise. You guys are using things and things that you wouldn't normally use. Our EMS professionals are going on with the fight and should be commended as such.
Yeah, absolutely.
I want to talk a little bit about resources. What are some of the challenges you're facing from a resource standpoint?
Well, one is the number of agencies and organizations that they need to try to get it from wherever they can. Suppliers are overloaded. It's supply and demand basically. Demand greatly outweighs the supply, so that they're having to talk to their vendors. Polk County Fire Rescue is talking to their vendors continuously. When somebody has something available, they're able to buy some, but just the quantities and the timeliness. We're so used to being able to sit down at our computer, click a few, make a few mouse clicks, and in some instances in 2 hours or the next day, the box shows up at your house or your business. We can't do that now. So we've worked with, we've had local agencies step up and donate, provide equipment back into that fight. One is Bartow High School, the health and medical program. They provided the supplies, gloves and masks and things that they use when they're teaching kids. Our future first responders and nurses, they donated that back to the system, back to the health care. Polk State College stepped up, did the same thing with some of their resources. Sun and Fun gave us some N95 masks that they had. So, locally those efforts, again, the relationships within Polk County are, everybody's working together.
We have just a little bit of time left. Paul, you as a leader within the Polk County community and director of the Emergency Operations Center, if you could tell the residents anything, what would you like to relay to them?
Yeah, the most important thing, follow the guidelines of the CDC, stay apart. I know it's disrupted lives. Everyone has personal situations outside of work. We got to work together. We got to take care of each other. We will get through this. This will eventually get better. Our lives have changed. Our world has changed. But stay apart. Do what you can to go to work when you need to. But after that, go home, take care of what you need to do. Get your groceries, get your medication, but just follow the guidelines of the governor, the Centers for Disease Control, and that's really the key. Follow what the science is telling us to do to keep this thing from not spreading. I've heard flatten the curve. That's the goal, is to contain it, keep it from spreading until a vaccine can be done. So we have to take care of each other.
Paul, I want to thank you for joining us today, and really want to commend you and the rest of the Board of County Commissioners on what you're doing to combat this coronavirus. Thank you for everything.
Yeah, thank you, Brian. There's a lot of folks working behind the scenes to take care of Polk County.
That's going to do it for this Polk Government Television special on the coronavirus disease, COVID-19. Now, if you need more information locally, you can give the Florida Department of Health in Polk County a call on their dedicated COVID information line, 863-519-7911, or go to floridahealthcovid19.gov. I'm Brian Lacey, and remember, we're all in this together.